Hello and welcome to Your Coaching Journey, a podcast for doctors about coaching. Whether you're a coaching doctor, a doctor who is learning to coach, or a doctor who'd like to build coaching into your professional life, then this is the podcast for you.
Hello, I'm Helen Leathers, and with me today is my co-host and business partner, Tom Dillon. Hi Tom, how are you today?
I'm marvellous.
Of course. Of course you are.
How are you, Helen?
I'm very well, thank you. And I'm really looking forward to exploring another approach to coaching with you today. So tell me what we're talking about.
We're talking today about motivational interviewing, which is actually not really, it's come into the coaching world, but it's not really approached to coaching. It's a medical intervention.
Okay, so tell me more about what it is.
Well, it's a medical intervention that was introduced by Bill Miller back in the 1990s. And it was really on the back of doctors struggling to help people with alcohol dependency. So motivational interviewing was sort of like a coaching conversation, but a conversation that would help people to overcome their dependency on alcohol. And since then, it's been used in lots of other ways. So smoking cessation, perhaps people getting fitter, losing weight, that sort of thing. So it's become more widespread and it's commonly used within the medical profession. Lots of GPs will have come across it. It's quite heavily researched, so there's lots of data around its effectiveness and its efficiency. So it's a well-researched tool.
But there's some interesting things about the research, isn't there?
Well, I, like all research, we have to take it with a pinch of salt. So I've studied psychology, so I'm used to experimental research where things are found out. But quite often it's with a student population that's not representative, and sometimes you wonder why the studies were done because they don't seem very helpful. So quite often in some of the research that's done around motivational interviewing, they will look at its effectiveness against doing nothing, which there's not.
Does it come out as being effective against doing nothing? Yes, I thought so. Yes.
So, and if you were to research coaching against doing nothing, I would hope that coaching would come out more effective as well. Yeah. So there is that element, but let's not be dismissive of the research. There is hundreds of research studies done around motivational interviewing, and they all seem to point to some efficacy around the use of motivational interviewing.
And so this is sort of a reaction to people who've perhaps been told what to do, like drink less alcohol.
Yes.
And the ineffectiveness of simply being told drink less alcohol. This has been created as a way to help support and encourage that behavioural change.
Yeah, so a move away from the doctor being the person saying, well, you need to lose weight, and actually engaging the person in a conversation about what their thoughts are around losing weight. Okay,
so a nice bridge between medical consultation and coaching.
Yeah, that's how I would view it. Gateway drug into coaching.
Excellent.
We're getting to that. It's not coaching because I don't think it's broad enough. It's quite narrow in its remit, but I think it's a good intervention that doctors can engage with in quite short sessions. They might well within their consultation use some of the techniques that are used in motivational interviewing to help someone talk about some behaviour change that they're looking for.
Okay, so what would you say are the defining elements of motivational interviewing?
The defining elements are things that you will probably recognise as being coaching. So collaboration is one. So we're collaborating with let's call them the coachee, because we're talking about coaching. So collaboration, which in a way, I guess some patients might see their doctor as a bit of an adversary, that they're almost not going to do what the doctor tells them to do. So it's more about getting alongside the coachee and having those conversations in a collaborative way. So that's one element. Focus. So there's going to be something that we're focused on, which again for us in the coaching world, that's part and parcel of what we do. But that focus, so within a motivational interviewing session, it might well be fitness, it might be diet, it might be alcohol use. So there will be that focus. Evocation of change talk. So that we're trying to draw out of the coachee why they might want to change. So again, very very normal coaching practice, and then moving on, if we've got that change talk happening, moving on to planning and preparation for the change to happen. So nothing unusual. If we're coaches looking at this approach as maybe a different approach, I think we'd recognise most of what comes up. There are some interesting elements that we'll talk about in a moment that are slightly different to what we might do as a coach, but it is very much a person-centred approach that is different perhaps to how a doctor might be, and I think that's where we have to look at it. If you look at a doctor's consultation and look at coaching, this kind of sits somewhere in the middle, or more leaning towards coaching.
Okay, I'm still exploring using open questions.
Yeah, so interestingly, they have an acronym in motivational interviewing, which is OARS. So the O in OARS, so it's like rowing oars.
Okay.
So the O in OARS stands for open questions. The A stands for affirmation, so just affirming someone's perhaps ability to change. The R is for reflection, so reflecting about why they might want to change. And S is for summary, so we're going to capture all of the different elements of why they might want to change and summarise for them. So again, all of those elements are things that we would see in a normal coaching session, but are perhaps things that a doctor wouldn't do in a normal consultation.
So you mentioned that we then move into planning and preparation as well.
Oh yeah, we're not there. Not yet. We've got a way to go before we get to planning and preparation.
Well, what might come before that then?
Well, I think that getting alongside them, collaborating, letting them know that you're on their side and that you are there to support them rather than telling them what to do. So very much that being alongside them. So we're used to that in a person-centred approach. And I think that's an interesting element of this. So motivational interviewing, as I say, really came about in the 1990s. And Bill Miller was the main advocate of this approach. There were other people that fed into it. But he really borrowed from person-centred, so Carl Rogers' approach, which we've discussed on this podcast. He borrowed from solution-focused, again, something that we've discussed. And it's really a combination of those two elements. And somewhere in the middle is the client's, the coachee's readiness for change. So that's the bit that links the two. So person-centred, trying to elicit that change talk. Now, we in the coaching room will be very used to change talk because people tend to come saying, I want something to change.
Yes.
But for doctors, they might not have that already going on. So that readiness for change, and then looking at perhaps the ambivalence that people are feeling about change. So it might well be, well, I would like to weigh 12 stone. I currently weigh 15 stone. That's my objective. But I really like crisps and chips and pizza.
Who doesn't like crisps?
Exactly. So there will be reasons why the change isn't happening, and that ambivalence, so that, okay, well, I want that, but actually I enjoy doing this, is what we would explore in a motivational interviewing session. So recognising that the ambivalence exists and that we are going to move towards change. So another interesting element of motivational interviewing is developing the discrepancy between where someone is now and where they want to be. So really highlighting that. So you want to change, you want to lose weight, you want to be fitter, and you can see, how will you feel in that 6 months' time when all that is happening, and actually contrasting that with where they are now. So you say you like crisps, but actually you're not too happy with where you are at the moment. You're not feeling too comfortable with your weight and your energy, and there are reasons for the change. So developing that discrepancy. Now, that's, for us, is a very solution-focused approach. So perhaps that magic wand question of where, let's move forward 6 months, you wake up in 6 months' time and it's exactly how you want it to be, where would you be then? So I think the idea of developing discrepancy, again, comes from solution-focused approach. And it's that imagining a future that is different, but then comparing it with what is now. And maybe that is a slightly different emphasis in motivational interviewing, is that, okay, that's where you want to be and this is where you are now. And
the comparison.
Yeah.
So you talked about the readiness to change.
Yeah.
Tell me more about that.
Well, there's a concept in motivational interviewing which comes from, it's another model that's been borrowed, the trans-theoretical model of change, which looks at how people come to think about change. And again, it's one of those, I can see the concept. It's not a bad concept, but I'm not sure it's particularly accurate. So the idea is that people have a stage which is pre-contemplation. So before they think about it, they haven't yet thought about it, which
bit weird.
I think most people, if there's some change going on, people will know that things aren't quite right. And most people that come to coaching know something isn't quite right. So there will be some contemplation going on about change, but they might just dismiss it. So they might avoid thinking too much about it. It will be there in their minds, but they will. So that idea of pre-contemplation, I'm not sure it really exists, but it's there in the model. So, and the idea in motivational interviewing is that if we have that pre-contemplation, it's probably more than 6 months away. The change isn't going to happen in the next 6 months. Once we move on to contemplation, so at this point, the coachee, the patient, is actually talking about change. So they're contemplating a change, but they're not quite there yet. So the idea is that is within the next 6 months. If they started talking about it, it's likely to happen within the next 6 months.
And is that at the point where someone using motivational interviewing could step in and start that process?
Yes. What's interesting, I think, is that because this is a medical model, you're more likely to get a doctor suggesting the change rather than... So the contemplation comes as a result of an intervention from a medical professional. So they might do a health check in which it's recognised that someone is overweight, and they might raise that as a flag and say, how conscious are you of this, and what are your thoughts about it? So in that moment, I guess we understand then someone's readiness to change. If they just say, well, I don't care about it, I'm quite happy with my weight, stop talking about it, then we know that they're not ready for change.
Yeah.
But yes, so that contemplation is the point at which we're exploring it. If there is some ambivalence, then we're hopefully going to overcome the ambivalence that someone is feeling. Once we've moved on from the ambivalence, we're looking at preparation and planning, which is what we were talking about a moment ago. And once we've moved on from preparation and planning, so that is perhaps within the next month, the preparation and planning, then we move on to action. And once they've taken action, hopefully there's going to be some maintenance and then some success.
So this sounds like the solution-focused element.
Yes, so we said that at the beginning that it's a mix of person-centred, so that exploring the situation with the coachee, with the patient, is the person-centred approach, and then we move on to a more solution-focused approach of, okay, what are you going to do about it? What are your options here? How are you going to plan this? What resources do you need? And then moving to action, and then maintenance, and, as I say, hopefully success.
Great. And if anyone wants to know more about the solution focus, we covered that in episode 8.
We did. And we'll put a copy of the trans-theoretical model of change in the show notes so people can have a look at that. So I don't think it's perfect. Going back to, I'm sure I've said this before, that George Box, a statistician, has the idea that all models are wrong, but some are useful. So I think it's a useful model to think about how people might be approaching change. But as you and I know, someone might sit in a coaching session, they've not really thought too much about change before, but decide on that day that they're going to change, and it happens the next day, and they take action, and it's all happened very quickly. So I don't think it necessarily needs to go through all these stages to have a successful outcome.
And other people bounce between probably pre-contemplation and planning and right the way back to pre-contemplation again sometimes.
Yeah, and I think this is another interesting element of motivational interviewing that I'm a bit unsure about. The idea that this could be a short session and it could be a one-off session. I think if we talk about behaviour change, it's a much longer journey than that. So the idea that a doctor or a coach, or maybe a health coach or a dietitian could just have one conversation that elicits that change talk, and someone says, yes, okay, I've decided I'm going to do it. They might in that moment have decided that they're going to do it, but quite often we need something more happening than just one conversation. So to me, it's relying on that brief intervention, which, if we think about the medical profession, everything has to be brief. 10-minute consultations are a reality in the medical world. So the idea of investing in someone maybe having 10 sessions with a medical professional, probably wouldn't be the doctor, but it might be a dietitian, having 10 sessions using a motivational interviewing approach is quite expensive. So I guess there's that push to say, well, this is really effective in short sessions and maybe a one-off session. I have my doubts. I'm sure there's some research that tells me it's very effective and efficient. But
Probably, compared with doing nothing.
I'm sceptical. Compared to doing nothing, yes, it probably would be. But I have a little bit of scepticism. So I think it's useful to think about, but not that.
So you mentioned about behavioural change, and obviously we've talked about cognitive behavioural coaching previously in episode 14. It sounds like it could be blended with that kind of approach for someone who knows what they're doing in coaching.
Yes, so I think the bit that's missing in motivational interviewing is that overcoming the emotional and psychological barriers, the unhelpful thinking patterns that people might be experiencing when they contemplate change. So in motivational interviewing, you would look at that ambivalence, say, okay, so you want to change and you want to be healthier, and you can see the benefits of that, and you might say, and what are the benefits? And what are the benefits? And what are the benefits to other people? So you'd explore that in a really expansive way, and they might also talk, but then, I do like my crisps. So there's that ambivalence of, and I don't think my family would be very happy if I lost weight. There could be all sorts of reasons why they might come up with not taking action and procrastinating on it. And the concept of motivational interviewing is to play back that, to emphasise, to amplify the change talk. And what they call sustained talk is the sustaining the status quo. So you're on the lookout for that people, and you're going to reflect it back, but not amplify it. So you really, so you've got you like crisps, we've got that. But on the other hand, these are the benefits that you would experience, and this is how you would feel, and this is how people around you would notice. And so you're amplifying that side of it. So, but that's a very limited tool to actually create change. Because actually, if you've got people that are having psychological blocks, emotional blocks to change, then there's deeper work that needs doing.
And not very often, going back to what you were saying about how it is sort of suggested it might be a one-off intervention, oftentimes we don't find what the blocks are, the hurdles are, until we're on the journey already. We're already implementing our plan, and then we get invited out for dinner, and then we get... there's a party, or there's things that can knock us off track. Just thinking of the healthy eating kind of scenario, and it's then that we go, I'm off track. What do I do now? And if you've just had that one session, you're on your own. And
I'm thinking about that in terms of one of the things that motivational interviewers try to draw out is what resources you have. Who else could help you with this? You might say, well, my partner could help me. Now, the reality is their partner might not want them to change, and they might get some pushback from their partner or some sabotage on the part of their partner who's suddenly buying lots of crisps. I keep talking about crisps, but it's a good example. So there might be the reason that this hasn't worked is because their partner doesn't want the change to happen. So that, again, is something that if you just do a one-off session, you're probably not going to explore that. It's not going to happen, is it? So I think this is where bringing in some motivational interviewing techniques, looking at that ambivalence, I think can be really useful in the coaching room. But we're probably going to want more than that going on. So that going back and addressing why change hasn't. And I think if we take that cognitive behavioural approach, we are expecting things not to happen. It's lovely if they do. If after the first coaching session we have with someone, they go away and they say, it's remarkable, I've had this epiphany, I've now changed my life. That's marvellous. But we're kind of expecting people to come back and go, I didn't do that. I know I said I was going to do that, but it hasn't actually happened. And that's where coaching comes into its own in exploring, okay, what are the reasons that hasn't happened? And how can we overcome those obstacles that you're facing? And how are you feeling about that? And who's getting in the way? Because quite often it's not what they say is getting in the way. Sometimes they're getting in their own way, or someone else is getting in the way. So I think it's useful to bring in that talk about ambivalence and overcoming that, and that idea of amplifying the resources they have, their motivation to change. I think that's probably as the name would suggest, motivation is probably the key element of this. It's looking for that motivation that might spark the change in behaviour that we're looking for.
So you mentioned this is a useful sort of bridge from medical intervention into the world of coaching, but that the elements of motivational interview perhaps that are missing could be fulfilled with other types of coaching approaches like cognitive behavioural. And it sounds a bit like positive psychology interventions might be useful along the way as well, which is something that we'll talk about on another session.
Yeah, and I think if you were to ask motivational interviewing coaches, they would suggest that it is a form of positive psychology, that we are looking for that motivation to change. So yes, I think it's an interesting approach to coaching. I think it has its problems because it stems from the medical world, where it's trying not to be directive, because that is what tends to happen in the medical world. So it's very different from a GP consultation, where perhaps a GP in the past has been saying, right, you need to lose weight. And it's more of a, let's get alongside them. Let's not have that adversarial approach. Let's be with them on the journey. But I'm not sure it quite fulfills that in the way it intends.
But a good start.
A good start. And if we're going to integrate it into our coaching practice, then I think working with ambivalence is something to be worked on. The summarising, motivational interviews tend to do a much richer summary than most people would do. So they do look at amplifying the resources that people have and their readiness for change, their motivation to change, and really emphasise that, and say play back some of the barriers that might be there, but a much more rounded out summary, I guess. That's something that we might introduce into our coaching if we don't do it already, is summarising.
So a doctor who might have some experience of motivational interviewing because of its medical background might perhaps use it and utilise it with clients and see what happens, see what change that helps to bring about. And for those who are interested in coaching, we explore some of the key elements of motivational interviewing on our coaching diploma: the person-centred approach, the solution-focused approach, and then the other elements as well, the cognitive behavioural coaching, that all help to overcome those psychological and emotional barriers. So we do the best of everything, really. Yes,
so I think it's a good place to start, but perhaps if someone has that interest in coaching, doing a professional coaching qualification would be a good next step.
Absolutely. That's great. Thanks for sharing your thoughts on motivational interviewing. It wasn't something that I'd previously known too much about, so it's interesting to hear more from my point of view. And I'm sure that there's lots of coaches out there who have found it fascinating, and doctors who've also found some common ground and are now perhaps able to explore it a little bit further. So thank you very much for that.
You're very welcome. And I think it's definitely something doctors will have come across and may not quite have understood the differences between that and coaching. So I think it's a useful exploration of it. So no, I've enjoyed talking about it. So thank you.
Good. Next time on this podcast, we will be interviewing another coaching doctor, Dr. Michelle Gooding, who is an experienced GP. You like Michelle, don't you?
She's lovely, Michelle. Yes, I shall look forward to that.
She is one of our early diploma courses, and following our transformational coaching diploma, she has transformed herself and her life and is now specialising in coaching doctors around their well-being and is a coach for the Joyful Doctor. So really looking forward to seeing Michelle.
And she'll be joining us from an aircraft fuselage.
Yes, she's got this great office space in her back garden that was once an aircraft.
Part of an aircraft.
Yes.
I think it's the fuselage. I'm not sure, but anyway, we'll look forward to that.
Excellent. Of course, no one will actually see that because we are on a podcast.
But we'll know.
We will know. Brilliant. Until then, bye for now.
Bye-bye.
This has been a Monkey Pants Productions podcast.